agenda item 3, COVID-19 lesson learned, getting ready for the next pandemic. This is one of the key items of our agenda. This meeting will draw on the experiences of member states in their response to the pandemic to see how we can further improve our joint emergency preparedness and response for the future. We can see on the screen the relevant documents for this agenda item. As mentioned before, progress reports are thematically clustered to other agenda items. The committee will be invited to note this progress report under item 14 later in our agenda. Before we focus on the situation in our region, it is good to also hear from other parts of the world. First of all, it is my honor and privilege to welcome Dr. Anthony Fauci, Chief Medical Advisor to the President of the United States. Dr. Fauci, thank you for joining us live from Washington. It is such a great pleasure and honor to have you with us. Could I kindly ask you to share with us what are some of the key lessons that you are personally drawing from this global health crisis, but also what lessons the US had learned in terms of the preparedness and response to health emergencies? Dr. Fauci, you have the floor.
Thank you, Madam President and Regional Director Kluge. Dr. Kluge, it has been a pleasure to meet with you twice earlier this year, and I'm honored to be invited to speak to the Euro Regional Committee today. As many of you know, European and United States scientists have helped lead the global effort to discover and evaluate medical countermeasures to address COVID-19. Therefore, let me start by thanking each of you and your governments for continuing to support this fundamentally important pandemic response and preparedness research, both in the past and especially into the future. As for lessons learned, first, COVID-19 has taught us that long-term investments in global disease surveillance and basic biomedical research are essential to identify and prepare for emerging diseases with pandemic potential. I would note sustained research investments over the years prior to the emergence of SARS-CoV-2 enabled the unprecedented pace of COVID-19 vaccine development. Two activities in particular predated successful COVID-19 vaccines: the development of versatile vaccine platforms and the adaptation of structural biology tools to design specific proteins, immunogens that is, that powerfully stimulate the immune system. The discovery of an immunogen adaptable to multiple life-saving COVID-19 vaccines resulted from collaboration across different scientific subspecialties in the United States, in Europe, and elsewhere. Moving forward, all our countries need to commit to the strengthening of emerging diseases surveillance and infectious diseases research capacity. And very importantly, to the open sharing of data and research materials to assure a rapid and informed global action. Second, the pandemic has demonstrated that public support is essential for research success and for the effective uptake of public health and clinical interventions. This is particularly important with communities that are skeptical, disadvantaged, or historically exploited. To build trust, we need to clearly explain why and how public health knowledge and guidance can change as new data accrue through well-designed research. During this pandemic, there's been considerable mistrust. Addressing the causes of this mistrust must be a priority going forward, whether it is caused by a lack of understanding or active disinformation campaigns. Third, the pandemic has reminded us that global cooperation and collaboration are essential in the modern world where national borders no longer restrict population movement. Fortunately, using the tools of modern science and communications, public health officials and scientists can work together more efficiently than ever. Moving forward, we need to take full advantage of these tools, especially to be better prepared to detect and respond to future health threats. And finally, we have learned how valuable public-private cooperation can be as we developed and test vaccines, therapeutics, and diagnostics as quickly as possible. In the United States, Operation Warp Speed and other initiatives enabled such partnerships, and they resulted in an unprecedented timeline for vaccine research and development. As the pandemic recedes, we need to do all we can to keep these partnerships robust. Much has been learned about this novel pathogen and the disease's causes. However, many scientific and public health challenges remain that require political will, robust research, scientific acumen, community engagement, and a commitment of substantial resources, both domestically and globally, to bring this historic pandemic to an end. In all these areas, as you all well know, the multilateral agencies like WHO and Euro have a key role to play as they facilitate our collaborative efforts and remind us of the importance of equity and global well-being. The United States has firmly restated our commitment to WHO, and moving forward, we all need to find ways to strengthen our international organizations, particularly as we work together to be better prepared for future pandemic threats. And so thank you for the opportunity to address you today.
Thank you very much, Dr. Fauci, for your enlightening views. It's very important that we work between regions because it is clear to me that we are facing some of the same challenges and potential solutions. Only with global solidarity and more transatlantic scientific collaboration, we will be able to bring the pandemic under control. Before I let you go, I think our regional director would like to say a few words.
It is so wonderful to see you, Dr. Fauci, at our region committee. And thank you for receiving me so well when I was recently in Washington, D.C. Let me thank you for your global leadership. I was telling you in August that you have many friends in the WHO European region. And thank you to your president for the commitment to WHO. Maybe one point, Dr. Fauci, if you allow me, one of the similar challenges that we are facing transatlantic is the question on vaccine hesitancy and misinformation. In fact, you touched upon this. So we really would appreciate if just maybe for a minute, Dr. Fauci could say something a little bit more about this one, about maybe some advice how we can tackle that big one on the vaccine hesitancy and the misinformation. And thank you so much.
Well, thank you for that very important question, because it is something that has been of considerable concern to us here in the United States. We are fortunate enough to have a supply of vaccine to vaccinate everyone in the United States. Yet, we still today have about 75 million people who are eligible for vaccines who have not been vaccinated. So the idea of hesitancy is a very significant issue. What we have done is that we have tried to outreach to the groups that have been hesitant to accept vaccines, but we've done that by what we call trusted messengers. So although I and many of my colleagues in public health continue to send out the message to get vaccinated, we find it is much more efficient to get trusted messages from the community. They could be religious leaders, entertainment individuals, or sports and community heroes. They are listened to much more readily than official public health people like myself. The other issue is that we have, because of social media, a considerable amount of disinformation and misinformation that spreads widely. The only way we have found to counter misinformation and disinformation is to provide in a very copious way correct information. And we do that through utilizing the social media, things that we never would have felt would be used for public health. Things like Instagram and Facebook and TikTok and things like that. I would have never thought that I would have been involved in that in my life, but in fact, I am because of the utilization of that by so many others. And finally, we have tried our very best to include community members in our clinical trials in order so that they can participate in the research and go out into the community and validate that everything was done in a scientifically and ethically sound manner. So thank you for giving me the opportunity to answer that question.
Thank you, Dr. Fauci, for your valuable advices. We will now release you as you have to attend other urgent matters. Thank you for being with us today and for making time in your busy schedule. Moving to another part of the world, I'm very pleased to welcome the Regional Director of the Eastern Mediterranean region, Dr. Ahmed Al-Mandahari, for a short reflection on how the pandemic has shaken his region and the specific challenges it created. Dr. Al-Mandahari, you have the floor.
Thank you very much, Madam Chairperson. It is really appreciated to give me this privilege, and I'd like to thank my dear brother Hans for giving me this honor to join your excellencies and sharing with you our input as a regional, as a region, which is sharing so many things. It is not just borders with our dear Euro region. It is a pleasure and honor to address the Regional Committee for Europe. Our two regions, as I said, yes, we share borders, but at the same time, we share much more. We share cultures, we share economies, we share history that we cannot forget, as well as we share lives that cross borders with health-related challenges and needs. Furthermore, as you know, Your Excellencies, the Eastern Mediterranean region is the source of around 64% of the world's refugees, which makes it of special interest to everyone. We have excellent cross-border collaboration with our Euro colleagues to manage the crisis, for example, in Afghanistan, in Palestine, and in Syria. We are united under the shared health agenda of GBW13, and collaboration has strengthened further during the COVID-19 pandemic. EMRO, as you know, Your Excellencies, is a complex region of 22 countries with wide diversity in socio-economic status and health systems, almost half of which are experiencing large-scale humanitarian crisis. Managing the pandemic response in that context has presented multiple challenges, but also at the same time, we have many opportunities. We have become more agile, resilient, and collaborative, and health has become the #1 priority for our countries. We have learned that working together with all sectors and communities is the only way to succeed. The pandemic has highlighted the value of comprehensive all hazards emergency preparedness and response. We are working with countries to strengthen their approach to emergency management, to align it with international standards, and best practices with a sustainable multi-sectoral health system perspective. We have achieved notable successes. We have levered our influenza systems and now have over 600 laboratories in our countries with PCR testing capacity. 14 countries have also acquired genomic sequencing capacity, and more will follow. Over 1,200 of our field polio staff were repurposed to support the response. Our Dubai logistic hub has served the global response, dispatching 438 shipments to around 110 countries across the world. But the COVID-19 vaccine rollout has highlighted serious inequities. While several of our wealthier member states have made impressive progress, six countries in the region have fully vaccinated only less than 2% of their population. We have established dedicated teams to support those countries. I have set up various platforms to engage our member states and promote inter-country collaboration. Similarly, and together with my dear friend and brother, Hans, we have now established a platform for bilateral discussion between our two regions. With numerous joint borders, movement of migrants and refugees, and risk of disease spread across borders, we can advance the joint work, including optimizing skills of migrants and refugees and improving collaboration on points of entry. Let me close by acknowledging the generous support of Euro member states, which has been strong partner to our region for many, many years, particularly supporting WHO's preparedness work and humanitarian response in numerous countries in the region, both technically and financially. Such partnerships are invaluable for our collective health security and for protecting and supporting the most vulnerable here in the region. I thank you sincerely and seek your continued invaluable engagement and support to advance our region vision of health for all by all. I thank you, Madam Chairperson. Thank you.
Thank you very much, Dr. Al-Madhari, for sharing with us your work, reflections, and thoughts. And now it is also my pleasure to introduce Dr. Matshihido Moeti, Regional Director of the WHO African Region, who will address the Regional Committee through a pre-recorded statement.
Chairperson of the 71st session of the Regional Committee for Europe, WHO Regional Director for Europe, my dear friend and colleague, Dr. Hans Kluge, Excellencies, Honorable Ministers, delegates, and colleagues. I'm very pleased to join you all in this session. Thank you for having invited me. While we are battling COVID-19, we must also prepare better for the next pandemic. Weaknesses have been revealed in health systems of all levels of development, showing that every country should invest more in providing quality care. In the African region, decades-long underinvestment in health systems has left populations incredibly vulnerable. Countries also face a range of other emergencies like cholera and Ebola and humanitarian crises in the Sahel and other places. These external shocks never stop. Building more resilient health systems is therefore a top priority. This goes hand in hand with scaling up local production to safeguard access to essential commodities. Overall, preparedness must be recognized as a key component of national development and security agendas. COVID-19 has reaffirmed that the world is connected with a shared vulnerability, so equity must be at the forefront of our collective efforts. Right now, to stop people from dying of COVID-19, Africa's access to vaccines needs to exponentially improve. Countries have shown that they can get the vaccines into people's arms. Supply shortages remain the major bottleneck. Finally, the pandemic has highlighted that the world needs WHO and that the organization must be adequately funded. I'd like to appreciate the support of the European region, particularly the United Kingdom, Germany, and the European Commission, who are among the top financial contributors to WHO's work in Africa. Together, we are striving to save lives, improve well-being, and serve the vulnerable in response to COVID-19 and other major priorities. Thank you for your attention.
We are grateful for Dr. Moeti's opening statement. Now, let us come to the experience built with this region. Before I give the floor to Dr. Dorit Snitsan, Regional Emergency Director of WHO Europe, we are also very honored to have received a video message from EU Commissioner for Neighbourhood and Enlargement, Mr. Oliver Varhelyi.
Dear participants, it is a pleasure for me to address your panel today. Together, we have come a long way since the outbreak of the COVID-19 pandemic. This pandemic confirmed clearly that we can work together, we can find common solutions, we can rely on each other. This means that we can also recover together and come out of the crisis stronger. Our common efforts help to better understand the virus and its varieties. We have a number of available treatments and measures to fight against infection and illness. But most importantly, we have now vaccines available to stop the pandemic from spreading. It is an important achievement of the scientific community. From the start of the pandemic, the European Commission has stood by its partners in the Western Balkans and the EU's immediate neighborhood. Despite the global shortage, the EU has delivered life-saving equipment and vaccines. First, with emergency medical equipment like masks, ventilators, intensive care units, and ambulance vehicles. Second, by strengthening the resilience of the partner countries. Third, we have helped to secure vaccines, especially for the medical workers, as well as for vulnerable groups. Now, we are helping to launch the socio-economic recovery. We care for our partners. The role of the World Health Organization remains of paramount importance, and let me express our appreciation for your commitment and determination to address the pandemic. Our close cooperation has helped to roll out the vaccination campaigns and ensure the resilience of the healthcare sector across the Western Balkans and in the Eastern Partnership countries. Currently, I see 4 key challenges ahead of us. First, a steady supply of vaccines. In most partner countries, progress is visible, but to stop the pandemic, we must vaccinate more than 80% of the population. We're still far from those levels. EU member states are ready to share vaccines. Please let us know your needs over the coming months, and I will do my best to facilitate the vaccine sharing by our member states to fill the gaps. Second, the absorption capacity for vaccination. We have noticed that not all partners have sufficient capacities to roll out their vaccination strategies. These need to be increased for an efficient vaccination campaign, especially to reach the most vulnerable groups. The support of the WHO for training, planning, and preparedness is much appreciated. Third, fighting vaccine skepticism. More and more partner countries face problems to ensure that a sufficient number of their population get vaccinated. In some cases, even reaching more than 20–30% of the population looks challenging. We remain ready to continue supporting these countries. We need to avoid a vicious circle of continuous waves of infections with high numbers of victims and its socio-economic damages. Fourth, the long-term modernization of the healthcare systems. This pandemic might provide an opportunity to work on the functioning and resilience of our healthcare systems and address some of the long overdue shortcomings. Not only as regards the COVID-19 and other infectious diseases, but also more broadly in terms of the infrastructure, staff, access to treatment and training. Only the vaccine can stop this pandemic. I wish you a good discussion on the European immunization agenda for 2030 and how to build better health for tomorrow. Thank you for your attention.
Thank you, Commissioner Varhelyi. We are so grateful for the solidarity displayed by the Team Europe Action in the context of COVAX, but also more broadly in the support to help strengthening countries' health system resilience across our region. Now, Dr. Nitzan will present the main conclusions drawn from various sources, including interaction reviews, consultation with member states, also including the recommendations from various panels and review committees. Since this is the first presentation that will be shown during this session, let me inform you that the Russian version of all presentations will be made available to you through a separate link that will be communicated to you in the Zoom chat and on the screen too. Dr. Nitzan, you have the floor.
Thank you. Thank you so much, Madam President, distinguished ministers and country representatives. Yeah, I can still remember that ring on my phone at 9 p.m. on the 24th January 2020, announcing the first cases of COVID-19 in our European region. It was a call that we had been expecting and had been preparing for. And yet, it marked the first step of a long journey. We immediately activated our response team and started supporting countries. You can see the timeline and all the information on our website. Almost 20 months ago, and we started that journey, but our learning curve has been unparalleled. Throughout the COVID-19 pandemic, WHO Euro has been supporting member states through in-country deployments and virtual missions and remote trainings by providing expert guidance and advice through the whole house, actually, and the whole WHO, securing access to medical and laboratory supplies, also with and through our operational partners. The support activities can be viewed also on our website. Next, please. Today, we are presenting the lessons learned in order to achieve a European region that is resilient and is able to stand and withstand against health emergencies. They were developed based on an online consultation with member states and partners, recommendation made by global review committees, the discussions that our regional director held during these past 20 months, and he has held a lot of those deliberations, meeting in countries and in-house, lessons learned from the intra-action reviews undertaken by yourselves, midterm report on the action plan to improve public health preparedness and response in the WHO region 2018 to 2023. They also link to the health transformation in the digital age during the COVID-19 pandemic document and is guided by the European Program of Work, the EPW, that we all know. Next, please. And if I could summarize our learning in one sentence, it would be that universal health coverage and preparedness of the health systems, other sectors, and communities pay off only if they come together. And this is the recipe for resilience. Let me explain. On one hand, countries with universal health coverage anchored in primary healthcare, as mentioned by our regional director, were more agile and ready to deliver comprehensive, people-centered response. They were ready to immediately integrate core health programs into emergency management. On the other hand, countries where the whole of government and the whole of societies were prepared had architecture to steer and coordinate an evidence-based response to engage communities, include the vulnerable, prepare urban and rural settings, and guide actions with equity and solidarity. Prepared health systems based on universal health coverage and preparedness of the other sectors and communities are the necessary ingredients and preconditions that we all agreed. These are the preconditions for resilience against health emergencies. Neither is sufficient alone. The IHR 205, next please. Oh, you see this, okay. The IHR 205 requirements must be embedded in all of them, and you can see that red line connecting them all. Next, please. Certain cornerstones should be installed in each of those necessary and dependent parts. For example, the whole of society, the whole of governance are based on committed and trusted governance, command control coordination architecture, collaborations and partnerships, and very importantly, as we heard, community engagement. Prepared health systems should be ready to deliver medical countermeasures, manage cases and investigations, invest in the health workforce and health infrastructure, deliver the full package of essential services, and communicate the risk while managing infodemics. Next, please. We agreed on 10 lessons learned. Our first lesson emphasizes the fact that health, society, and the economy are inseparable. The pandemic has reminded us that health is the foundation of a functioning society, and that the value "no one is safe until everyone is safe" needs to be at the forefront. The second lesson calls to prioritize the preparedness capabilities, including the IHR capacity gaps within the all hazards framework. The third lesson indicates that response systems need to be functional long before the emergencies strike. The emergency response architecture, top-down, but we should not forget, bottom-up, needs to be ready for all hazards. Prepared health systems with breakthroughs in biotechnology, genetics, and epidemiology led to the isolation and sequencing of the SARS-CoV-2, thus delivering diagnostic tools and novel vaccines in no time. Lesson 4 is about the transformation of scientific discoveries into accessible and affordable public health goods. The fifth lesson is based on the fact that prepared health systems are those that use contemporary tools to access data and that use it for policy making. The true life-saving potential of data has yet to be uncovered, and a paradigm shift is required in how health data is sourced, governed, certified, protected, shared, and of course, digitalized. Lesson 6 is about recognizing the health systems and emergency preparedness, their connectedness, while lesson 7 is based on the fact that measures are only effective when they are scientifically sound, culturally acceptable, and are owned by the communities. The people need to be part of the solution. This requires new approaches of inclusive governance. Moreover, equity and solidarity must provide the compass for actions to improve health, social and educational services, together with financial protection. National interests should be linked with international cooperation and global solidarity. Vaccine distribution teaches us that we are as strong as the weakest ones. The just published Euro Health edition, the new one, special issue, in collaboration with the European Observatory on Health Systems, highlight these important issues that we just raised. Lesson 8 calls us to integrate emergency public health services and universal health coverage while investing in healthcare infrastructure and workforce is our lesson 9. Prepared health systems, requalified primary care, repurposed and redesigned hospitals, and optimized treatment of care of patients of COVID-19, alongside with the full continuum of health services from public health to primary care, hospital, rehabilitation, and palliative care, are key. Such systems were able to train, deploy, protect, and support the health workforce. They are the hero of this pandemic, and we need to take proactive measures to support them all through the way and help them to communicate it with the rest. We need to train them and to have them all skilled at communicating risk and rapidly addressing rumors and misinformation. Our 10th lesson is prioritizing resilience. It sounds now really something that we all understand, but this requires a necessary leap to be taken by all of us so that we will prepare us and the next generations for the upcoming emergencies. The pandemic, if I may, also taught us humbleness, respect, and responsibility. We humans are, well, we all know it, we are part of a huge dynamic interaction between life and nature and among ourselves. We need to apply these lessons to the way we handle the environment, nature, animals, and everything else within the One Health web. And we need also to use it in the way we protect our health and the health of those around us. Next, please. We cannot stop as the pandemic journey continues. The regional director called for a high-level European expert group to take the step already. You mentioned it, Regional Director early on. It is chaired by Professor Flo. The expert handed a concise document with guidance on how to get out of the acute phase of the pandemic and move into stabilization phase. It is also on the web. They will continue adapting it as needed, and we are very grateful as they are leading us through the journey. Next. Being prepared for the next pandemic means ensuring that the current one is used to switch from coping to anticipating and transforming. The devastation of COVID-19 has brought us can only be worsened if we fail to learn. Today, we stand at a critical juncture when we are still crying over the loss of our dear ones, the sufferance that many of us are going through while experiencing the impacts and challenges of the pandemic. But we have the knowledge of nearly 2 years of fighting it. We now have an effective toolbox which we need to share with all. We have learned that no man and no woman is an island, and no country is a lonely planet. At the WHO Regional Office for Europe, under our regional director, under your leadership, we are committed to work with you to make sense of this wealth of lessons, to review the current action plan, and eventually develop a new one to reduce the human toll of future emergencies. Well, I want to thank you for listening to this, but we decided to also continue and interview some ministers and our partners, and to listen to them firsthand and to understand what they have gone through. The question we ask them is, what are the major lessons your country or your organization has learned in its response to COVID-19 that could be taken forward to the next emergency? Please note that in order to be on time, we really were forced to cut some of those messages, and we will try to accommodate all those later on. Thank you very much.
Thank you, Dr. Nitzan. And before I move to the pre-recorded ministerial panel, I'd like to say that it has been brought to my attention that the Russian Federation would like to exercise its right to reply under Rule 26 bis as per standard practice based and in accordance with paragraph 10 of the special procedures. I'll give the floor to the Russian delegation at the end of our meeting today. And now I'll move on to the pre-recorded ministerial panel. I understand that now we'll hear from a number of ministers who will share their personal experience and views through a series of short pre-recorded videos. We will start with Albania. I'm very glad to participate in this ministerial panel on COVID-19 lessons learned. We certainly welcome this initiative to take stock and to learn lessons and to look back collectively at the actions taken so we can analyze what worked well and where we need further improvements. Regarding our experience with quickly establishing an agile and flexible command control coordination structure in Albania, let me emphasize that preparedness and prior experience in managing crisis has helped. The immediate experience from the devastating earthquake that hit Albania in November 2019 and accumulated lessons from previous emergencies were critical to build our institutional readiness. The command control coordination platform allowed to engage all the stakeholders in the rollout of the COVID-19 vaccination campaign and to design and oversee respective public communication and community engagement. Through our collective efforts across sectors and partners, we were eventually able to achieve our vaccination coverage target so far, but we need to continue and further consolidate the rollout and increase the vaccination coverage. Through the command's control and coordination structure, we also coordinate the necessary investments to strengthen public health, primary care and hospital services, and the repeatedly needed adjustments to service provision priorities with the perspective to sustain essential health services and to support the most vulnerable through targeted social protection measures. During this pandemic year, we have continuously reviewed our national guidelines arrangements to align public health safety measures to limit the spread of the virus with updated case management and investigation protocols. A newly established operational entity, the National Operator of Health Services, was crucial in following up the plans to scale up and adjust capacities as needed through the country. As an operational entity under the umbrella of the Ministry of Health and Social Protection, the National Operator of Health Services is overseeing the scale-up of testing, isolation, and contact tracing strategy, and also coordinating treatment capacities in the regional hospitals. This structure has contributed managing the health workforce expansion through mobilizing extra teams in different levels of care for testing, contact tracing, and strengthening medical teams in dedicated COVID-19 hospitals and in COVID-19 wards in regional hospitals. The strengthening of human resources for health was complemented by the government decision to substantially increase the salaries of the health workforce by 40%. To value their continued commitment, and since the beginning of the pandemic, we incentivized them with an extra monthly financial bonus. Well, now I'll give
Thank
the
you,
floor.
Chair, for the giving opportunity.
Okay. Now I'd like to introduce, I'll give the floor to Georgia, followed up by Moldova and Serbia.
unfortunately, death toll is still high. Therefore, our primary goal is and should be strengthen preparedness at national and the global levels, strong intersectoral cooperation and sustainable strengthening of comprehensive mechanisms such as active biosurveillance and epidemiological control, as well as building capacities for diagnosis and treatment, enhancement of preventive measures are essential to efficiently overcome the pandemic challenges. Pandemic has also revealed necessity for strengthened additional mechanism of coordination between primary healthcare, hospital sector, and emergency medical care services. We can transform each new challenge into opportunity, and Georgia is a good example of this. Due to urgent needs in the pandemic management process, the country has taken important measures to improve sustainability of healthcare system. The pandemic revealed necessity to speed up the process of strengthening state sector, which is ongoing with financial and technical support of the WHO, European Union, the World Bank, and other donor organizations. Besides, brand new and innovative approaches have been introduced, such as utilization of hotels for management of suspicious cases, as well as COVID-19 patients that have been applauded by our international partners. The pandemic made more vivid the role of telemedicine and digital technologies in healthcare. Distance services significantly reduced mobility and risk of spread of infections in hospitals. At an early stage of the pandemic, Georgia introduced successful practice of electronic services such as online clinics, which represents an effective home-based management of COVID patients. Today we have vaccines, the main weapon to end the pandemic. Equitable access to COVID-19 vaccines has a significant importance for all the countries. COVAX, which represents an effective mechanism for fair distribution of vaccines, had a critical role in securing early doses of COVID vaccines in the country. However, it's essential to improve accessibility not only to vaccines, but to all public health benefits that are key tools in combating pandemics. The brief answer to questions what lessons are learned from the pandemic can be necessity to ensure pandemic preparedness, human resource strengthening for emergency response, introduction of additional mechanisms of coordination between primary healthcare, hospital sector, and emergency medical care services, necessity to strengthen state sector, importance of digital health systems, and intersectoral cooperation. I thank you for your attention.
When COVID-19 pandemic has started, Republic of Moldova level of preparedness was insufficient in view of personal protective equipment and medicine stockpiles, as well as human and financial mechanisms to ensure that adequate response to the public health emergency. Epidemiological risks in the Republic of Moldova was exacerbated by severe political and economical crisis. Due to this fact, the response to the pandemic was late and highly politicized. Price paid by the health system was enormous. Moldova became a leader in the mortality rate among health workers, but in particular doctors. We lost more than 134 colleagues in the first year. In autumn 2020, the presidential election took place and pro-European candidate Maia Sandu was elected. This staggered the huge wave of support from the European Union, United States, and other development partners, in particular Romania. I would like to mention tremendous support of Moldovan diaspora, which gave us heartbreaking example of community engagement and supported country in the first weeks of pandemic, sending home oxygen concentrators and personal protective equipment. It is also important to acknowledge the role of the public health authorities and police, including border police, and the entire support provided by all development partners, including WHO, UN agencies, EU, USAID, COVAX, governments of Switzerland, Germany, Norway, Austria. Joint effort and impressive stakeholders' engagement made possible that population of Moldova got access to the quality vaccines. Donation of vaccines from Romania and COVAX platform enable health authorities to start the vaccination of medical personnel immediately. we managed to reduce not only the mortality, but also the infection rate among doctors and nurses, and almost achieved herd immunity in this category of staff. Currently, about 95% of GPs, physicians and nurses, and 88% of medical workers from the Republic of Moldova are fully vaccinated. As of today, there is zero death in health workers and few cases of infection.
Najznačajnije mere i aktivnosti koje država Srbija sprovela tokom pandemije su da je Srbija izvršila efikasnu reorganizaciju i promenu načina funkcionisanja zdravstvenih ustanova, domova zdravlja i bolnica u cilju brže dijagnostike i adekvatnog lečenja pacijenata obolelih od COVID-19, ali i omogućavanje adekvatne zdravstvene usluge i lečenja pacijenata obolelim od drugih bolesti. Kapaciteti COVID bolnica su se povećavali u skladu sa intenzitetom transmisije virusa u zajednici i brojem inficiranih, u pogledu većeg broja bolničkih postelja za lečenje, kao i većeg broja raspoloživih respiratora za primjenu u intenzivnim negama bolnica i drugih medicinskih aparata i opreme. Izgrađene su 3 kompletne nove COVID bolnice opremljene najsavremenijom opremom sa više od 2000 bolničkih kreveta. Značaj novoizgrađenih bolnica za lečenje obolelih od COVID-a ogleda se u činjenici da je pravovremena hospitalizacija obolelih ključna za uspešno lečenje. Unapredili smo laboratorijske kapacitete za dijagnostiku COVID-19 kroz povećanje broja laboratorija i obezbeđivanje dodatnog zdravstvenog kadra za rad u laboratorijama za PCR dijagnostiku. Pored navedenog, Srbija je uložila i velike napore u cilju nabavke opreme i distribucije iste zdravstvenim ustanovama, podrazumevajući respiratore, ultrazvučnu opremu, dopremanje kiseonika za terapiju obolelih, nabavke rentgen aparata. Na kraju, među najznačajnijim odlukama i merama moram istaći da je Srbija donela stratešku odluku da je nabavka bezbednih i efikasnih vakcina i masovna vakcinacija najviši prioritet za državu i u skladu sa tim preduzela korake. U tome smo naišli na podršku i razumevanje partnera u svetu koji su prepoznali našu jasnu viziju. Rezultat toga je činjenica da je Srbija među prvima u svetu svojim građanima obezbedila vakcine različitih proizvođača i omogućila im izbor koju će vakcinu da prime. Srbija je, kao što znate, među prvim zemljama u svetu već 24. decembra 2020. godine započela vakcinaciju stanovništva počev od prioritetnih kategorija. Do 3.9.2021. godine u Srbiji je ukupno vakcinisano 3. dozom preko 208.000 lica.
Dear colleagues, there are many lessons learned from pandemic. One of them, and maybe the most important one, is that we need to increase our capacities. Capacity of response and resilience, capacity of multilateral coordination, and capacity of leaving no one behind. This pandemic has tested these capacities and has shown some structural weaknesses in fields like epidemiological surveillance or the amount of resources for primary attention and research. It has also revealed the risk for global health behaviors like vaccine, nationalism or fake news. But there are also positive conclusions. We are now better prepared for upcoming challenges. Spain has a public health system that is strong and universal because of the improvements that we have been implementing. We have already reached the goal of immunizing over 70% of our population in 8 months. We have proved our strength by reaching national goals while contributing globally with our vaccine sharing. I can proudly say that my country has learned great lessons during this last 20 months. We have confirmed that we have a great national health system and committed health workers that have made it through the pandemic. In addition, we realize that comprehensive health surveillance must come first in all our health policies. I can say something similar regarding primary attention, the milestone of our national health system, the closest to our families and our community. Thanks to primary attention's doctors and nurses, the Spanish vaccination culture has defeated an anti-vax movement and social rejection. Moreover, we learn how crucial co-governance is. In Spain, our national health system has facilitated a proactive dialogue with our region even in the hardest times. That improved tailor-made measures for the different regions of Spain, but always thinking of the greater good. That's unity of action. Co-governance works and its mechanisms must be powerful and have enough human and financial resources. Dear colleagues, I want to send you a clear message. We need a strong global health today to protect our citizens from tomorrow, the threats. Thank you very much.
Sayın Başkan, saygıdeğer bölge direktörü, kıymetli katılımcılar. Öncelikle ülkemin ve şahsımın COVID-19 ile mücadele sırasında edindiği tecrübeleri paylaşma fırsatı sunan böyle önemli bir oturuma konuşmacı olarak davet edilmem nedeniyle sevgili dostum Hans'a ve emeği geçen herkese teşekkür ediyorum. Hepimizin bildiği gibi iyi bir pandemi yönetimi, vakitlice yapılmış hazırlıklılık planları, iyi inşa edilmiş sürveyans sistemleri, teknoloji ve kaliteli insan gücüyle desteklenmiş yaygın, güçlü sağlık altyapısı ve iyi organize olmuş sağlık sisteminin sunduğu yanıt kapasitesiyle başarılı bir şekilde yürütülebilir. Kapsayıcı sağlık güvencesinin sunduğu tedavi hizmetleri ve iyi planlanmış ve önceliklendirilmiş zamanlı aşı tedariği de pandemiyle mücadelenin başarısını derinden etkileyen unsurlar olarak ön plana çıkmıştır. Sağlık çalışanlarının fedakar ve özverili çalışmaları ise tüm bu başarı unsurları arasında beşeri sermayenin de önemini teyit etmektedir. Kıymetli katılımcılar, bu toplantı vesilesiyle pandemi yönetiminde çok önemli bir olgu olduğuna inandığım toplumu mobilize etmenin ne kadar önemli olduğunu öğrenilmiş dersler ışığında sizinle paylaşmak isterim. Pandemi süresince hükümet politikalarını ve halkımızın günlük yaşantılarını derinden etkileyen, tasavvur edebileceğimizin bile ötesinde çok radikal kararlar almak zorunda kaldık. Bu süreç içerisinde karar mekanizmalarında bütüncül bir hükümet yaklaşımının parçası olarak paydaşlarımızın katılımını sağlamak da çok önemli bir vazifemizdi. Diğer yandan belki de en zor olanı kapatmalara, halk sağlığı tedbirlerine, tedavi metotlarına, özveri ve fedakarlığın gerekliliğine, yani toplum mobilizasyonu konusunda başarılı olabilenler pandemi yönetiminde bir adım öne çıkabilmişlerdir. Şöyle belirteyim, pandeminin ilk başladığı günlerde toplumumuzu maske kullanmaya teşvik etmek için mücadele ederken, geldiğimiz noktada aşı olmaya teşvik etme süreçlerini yaşamaktayız. Bilim ve kanıta dayalı güçlü, sürekli ve samimi bir iletişim metodu oluşturulması, toplum mobilizasyonunda başarıyı getiren temel kriterdir. Türkiye'de de pandeminin ilk gününden itibaren bu anlayışla hareket etme gayreti içerisinde bulunduk. Hem bilime hem de kanıta dayalı bu enformasyonu doğrudan en üst politik seviyede tüm ilgili paydaşlarla ve halkımızla paylaşma metodunu benimsedik. Bu yöntem pandemiyle mücadeledeki en zararlı unsurlardan olduğunu düşündüğüm infodeminin etkisini minimuma indirmiş, toplumsal katılıma ve bütüncül uygulamalara maksimum katkı sağlamıştır.
One of the strengths that we've all learned is the human factor and the healthcare workers. And because we know how important they are, I think the first lesson that we should all learn from it is that we need to invest a lot in our healthcare workers, in the professionals. We need them because without them, we won't be able to combat anything in the future. That is the first thing. At the beginning, I think that they were a little bit sidelined and they didn't take enough part, not as an organization and not as individual, with the decisions, or at least that wasn't the feeling. They didn't feel that they got enough information. They didn't feel that they knew exactly what was happening. And even when we're talking, for instance, about personal protective equipment, it wasn't at the beginning completely, didn't make people feel safe enough. So I think that the most important lesson that I would like to say at the beginning is that we need to invest in the healthcare workforce. We need to make the physicians feel safe. We need to give them information, and we need to encourage them to take a role that they did take as bringing forth messages to the public. One more thing that I want to say is we also have to invest into the healthcare systems. We cannot wait for a pandemic and then just decide that we are investing. And we know that many countries around Europe and possibly around the world at that point actually put in a lot of money into the healthcare system. But we need to be prepared before. We need to be in a situation where we will have enough hospital beds, where we will have enough physicians in the ambulatory setting, where we will have enough facilities to answer for the geriatrics needs and so on. And if we do that on an ongoing basis, then hopefully when the next crisis, I don't know if it'll be a pandemic or anything else, we will be better equipped for it. So I think that there is work to be done. I would like to just point out one positive lesson, and that is the collaboration. I think we would have never been able to overcome it without collaboration between all the stakeholders and all the players within the regional and within the international setting. We would never be able to get a vaccine or several vaccines within a year if it wouldn't have been a multi-central collaboration. We would never know how to treat our patients if we wouldn't be able to call our colleagues in other countries and learn from them what to do and what not to do. And if we are at the race for maybe finding medication, again, we need collaboration. So I think a collaboration between governments, between NGOs, between physicians and other healthcare workers, and between the public, I think that could be the best solution we could have.
Well, thank you very much, ministers. Dr. Webner from European Forum of Medical Associations. Let me now pass on the floor now to Executive President Dr. Silanauki for managing the discussion. Thank you.
Thank you, President Manastirli. Happy to assist you leading the RC71 discussions in the middle of these extraordinary times when the solidarity and joint actions are needed, perhaps more than ever. I now open the floor for any possible remarks, and we have here the list and order of speakers. And the floor goes first to Slovenia on behalf of the EU and its member states, followed by Denmark and Netherlands. Slovenia, the floor is yours.
Thank you very much. Chair, Director General, Regional Director, Excellencies, ladies and gentlemen. I have the honor to speak on behalf of the European Union and its member states. The candidate countries Montenegro and Albania, as well as the Republic of Moldova, align themselves with this statement. The European Union thanks the Secretariat for the reports. Learning the lessons from COVID-19 is critical in order to better address new and emerging threats and to address the severe damage caused by the current crisis. At the same time, we must prepare for different types of future health emergencies, such as the silent pandemic of antimicrobial resistance. In many ways, no region or country across the world, including the European Union member states, were ready for a pandemic of this scale. Preparedness and planning had been underfunded and underdeveloped. Much of the response has had to be designed as we went along. Coordination and cooperation between member states was insufficient and challenging, and took time to be developed and start functioning. Valuable time was lost in the early stages of the pandemic as the right structures were not in place. Speed, scope, ambition, and solidarity have proven to be essential and best achieved through strong multilateral cooperation. The lessons learned from this pandemic will be crucial in preventing the next one. The European Union is committed to an active and constructive role in the discussions at global level on strengthening WHO and health emergency preparedness, as well as on sustainable financing. The ongoing assessment of the different recommendations by the Working Group on Preparedness and Response is critical. The implementation of the international health regulations is the responsibility of all member states. It is clear we must do better. Beyond core IHR capacities, leadership and governance, strong and resilient health systems, accountability mechanisms, and sustainable domestic financing of preparedness have proven to be essential. Monitoring and evaluation of country capacities has been an important development that has not sufficiently captured the variety of preparedness and response needs across sectors. Furthermore, longer-term and sustainable resourcing of actions remains a challenge that needs to be addressed. This pandemic has shown there are areas that are not covered by the IHR or other existing mechanisms. The European Union believes that a new international legal instrument on pandemic preparedness and response would complement the global health emergency preparedness architecture while being mindful to avoid possible overlaps with existing structures. We need also to build on the experiences of effective ways of cooperation developed during the response. The ACT Accelerator and its COVAX mechanism for equitable access to COVID-19 vaccines point to the value of having an end-to-end solution for medical countermeasures in place during normal times. The ACTA strategic review will give us useful insight. Sufficient global manufacturing capacity alongside mechanisms for fair pricing, transparency, and accessibility, as well as increased voluntary sharing of know-how and technology is essential. We need to further strengthen cooperation in the human-animal environment interface through a One Health approach, including between WHO and FAO, OEE, and UNEP. This will help us prepare not only for zoonotic risks, but also for AMR and climate crisis, among others. The risk of increasing health inequities burden of non-communicable diseases, and toll on mental health are significant. Understanding is critical for future preparedness and resilience. Timely sharing of data and digital tools are essential for modern public health management and preparedness. The European Union supports the strategic directions proposed on leveraging the impact of digital technologies in the context of pandemic preparedness and beyond. We encourage all member states to take steps towards making this the last pandemic by critically evaluating and building on the lessons learned. Political leadership and multi-sectoral commitment are required in every member state when implementing the necessary changes. Thank you very much, Madam Chair.
Thank you, Slovenia. Next, Denmark, followed by Netherlands and UK. Denmark, the floor is yours. It seems that we have some technical problems to connect to Denmark, even we are here in Copenhagen. I would now call Netherlands, and let's see then if we can contact Denmark. Netherlands, please.
Good afternoon, Madam Chair, distinguished colleagues, and dear Hans. The Netherlands aligns itself, of course, with the statements made by Slovenia on behalf of the EU. Let me start by expressing my appreciation for the tireless work of the World Health Organization and of all health workers worldwide, but also of you, Hans, and your team. Your inspiring enthusiasm and the work of your team are very important for the region, especially in the months we have behind us and the months to come, I would say. And this COVID pandemic has taught us a lot about the strengths and the weaknesses of our respective healthcare systems, the global health architecture, and the essential role of the WHO. Therefore, we believe that our energy should be aimed at concrete actions in at least the following areas. Firstly, we need to reevaluate and strengthen our local and national public health services and give priority to full IHR implementation and to the prevention of non-communicable diseases, so we make sure that our populations are as healthy as possible. Secondly, we need to secure the availability of essential medical products and enlarge the worldwide capacity of sustainable products and production. The Netherlands will, therefore, we have committed ourselves to donating all our surplus vaccines to lower and middle income countries, especially through COVAX. And we call on all other countries to do as much as they can when it comes to donating of vaccines. Furthermore, the Netherlands will, in collaboration with the World Health Organization, organize the next World Local Production Forum. And this forum will be aimed at increasing access through public-private partnerships and sharing of knowledge and technology. Thirdly, we need to improve collaboration on health security and pandemic preparedness on the basis of a One Health approach. The interaction between animal health, human health, and the environment, and the challenges of climate change for the health agenda requires common action, including prevention of antimicrobial resistance. We can only overcome these challenges if we are transparent about what is going on in our countries and improve data sharing and collaboration. We have to work on increasing trust and international solidarity, and we should be supportive of a pandemic treaty that represents a generational agreement. A strong WHO at the heart of the global health coordination can help us facilitate our dialogues and provide the necessary guidance for our governments. For this, We urge all member states to strengthen existing structures of the organization, including the regional offices, and provides predictable and sustainable financing. Let us learn from this pandemic and protect the health of all our people. Thank you very much.
Thank you. And now, do we have a connection to Denmark? If not yet, then I would like to ask UK to take the floor, followed by Israel and Monaco. UK, the floor is yours.
Last week at the G20 in Rome, we saw how we're all in the same boat, dealing with the consequences of a devastating global pandemic. Even while we do that, we must also learn lessons for the future. First, we saw how clinical trials turned the tide of the pandemic. We must keep going. Whether it was the WHO's Solidarity Trial or the UK effort that found the benefits of dexamethasone, we all benefit from this life-saving work. But making trials work must be a collective endeavour. The Clinical Trials Charter, agreed this summer in Oxford with the G7, will help end unnecessary duplication of trials, ensure greater collaboration across borders, and faster access to approved treatments and vaccines. Working with industry, we have also set a shared goal to cut the time that it takes to develop and deploy new diagnostics, therapeutics, and vaccines to just 100 days. Because in a pandemic, it's not just about progress, it's about the pace of that progress. I must also urge everyone to do their utmost to resolve the issue of vaccine certification for people who took part in clinical trials. They stepped up for science, and we must step up for them. Second, genomics has been indispensable in this pandemic. It'll also be crucial to preventing the next one. We will offer UK expertise via our new variant assessment platform and global pathogen analysis system as part of the global pandemic radar. Next, we must have a shared understanding of the origins of the COVID-19 virus. The phase 2 study must be prioritised. It must be transparent, evidence-based, and expert-led. Because when diseases can cross that divide between animals and humans, it matters to us all, and it matters to our future. And finally, we must protect the miracle of modern medicine and tackle the silent pandemic of antimicrobial resistance, which could have consequences far deadlier than COVID-19. We must also get better at using existing antibiotics, whether for humans or animals. We must share and develop new ones and ensure safe global supply chains. In the early stages of this pandemic, we faced the disease without any proven treatments. We can't allow the world to be put in that position again. But I believe, through the sum of all these actions, we can avoid that fate and herald a healthier, safer, and more sustainable world.
Thank you, UK. And next, Israel, followed by Monaco and Russian Federation.
Honorable Chair, Director General, Regional Director, Ministers, Ambassadors, and colleagues, good afternoon from Jerusalem. We've all faced a terrible pandemic for 8 months now, but we've faced it together. Countless lives have been saved through international cooperation and the efforts of the WHO to collaborate in combating this pandemic. Still, we have a way to go, and it is too early to predict the end of this pandemic. But I believe some lessons can already be learned and applied to both this pandemic and future outbreaks. First of all, cooperation. COVID-19 has taught us of the need to adapt the way we work together cross-government and internationally. Information sharing and coordination have been a key factor in effective policy and implementation. With a joint emergency management center created in Israel to coordinate interministerial efforts to combat the pandemic and daily calls between expert international gathering, best practices, and critical information to inform the decision makers. Second, home care. Flexible approaches to future health systems has been critical to maintaining operational continuity of the health system throughout the crisis. In Israel, we expanded our healthcare options to include home care options. This system was critical to freeing up our hospitals and resources. Third, digital tools. It is absolutely critical to integrate digital tools to ensure remote access and enable better service while maximizing efficiency of healthcare workforces. Digital tools can also stretch scarce resources not only during emergencies, but even in routine times. Four, travel. Safe travel systems must be put in place in order to diminish the risk of variant spread. We need a comprehensive system of testing, secure and verifiable vaccination, certification, and risk assessment of new variants paired with early detection of high infection areas. Green Pass. In Israel, we are reopening our economy on the basis of a Green Pass system available to all on the basis of vaccination, recovery, or testing. Blunt tools such as lockdowns are not sustainable. This is our conclusion. Blunt tools such as lockdowns are not sustainable as we rebuild our economies and learn to live alongside with this terrible pandemic. We are using this Green Pass system to enable businesses to safely reopen and expand capacity, to enable people to be together after far too much time apart, and to begin to heal the psychological wounds of the past year and a half. Another important issue, fake news. Information knows no borders, and I call for a regional approach to combating anti-vax sentiments and tackling misinformation. Often data or experts from one country are misrepresented in another in order to undermine vaccine confidence. Only through international partnerships we can address this misinformation before it has succeeded in undermining national vaccination efforts. A regional task force would enable collaboration and data sharing to combat misinformation, fake news, and maintain vaccine confidence. Another important point, vaccine production. We need to expand capacity for vaccine production and distribution. This pandemic has shown that vaccine production facilities are no simple good to be traded across borders, but that access to safe and timely vaccines is a critical factor of national resilience. Nations should cooperate between themselves and with industry in order to expand that capacity and maintain surge capacity for times of need, just as we may for other emergency supplies. Lastly, regional cooperation. It is essential to expand our cooperation so that we can learn from each other. This is why I met with my Palestinian colleague from Ramallah. This gathering is so important, this one. And so I hope we can all meet face to face and continue this important work together. Thank you very much.
Thank you, Israel. I would like to kindly remind you about what we have agreed of the length of the comments from you. There is a lot, I understand that there's a lot you would like to include into your comments, but we have very, very challenging timetable here. So please, I ask your understanding, and if you try to keep in 3 minutes time in your national comments. Now I would like to ask and give the floor to Monaco, and after that Russian Federation, and then we have Denmark's comments through video. So Monaco, the floor is yours.
Je vous remercie, Madame la Présidente exécutive, et encore mes félicitations pour votre élection. La principauté est bien entendu un fervent partisan du multilatéralisme et nous partageons ce qui a pu être dit en matière de solidarité, de coopération, mais mon intervention se fera selon la perspective d'un micro-État. Nous avons pu tirer à ce stade trois importantes conclusions. D'une part, le renforcement de l'autonomie de Monaco dans la gestion de la crise sanitaire. Cela nous a permis, à titre d'exemple, de mettre en place des centres de dépistage, de vaccination, mais aussi de développer la production locale de masques et de gel hydroalcoolique. Nous avons pu exploiter les spécificités d'un micro-État pour mieux gérer cette crise sanitaire en faisant, par exemple, du dépistage massif de la population, de la distribution gratuite de masques à l'ensemble de la population, mais aussi de larges tests afin de vérifier le dosage des anticorps neutralisants pour connaître le niveau de protection de la population. Enfin, nous avons fait preuve d'innovation dans la gestion de la crise et c'est passé essentiellement par la transformation des systèmes de santé à l'ère numérique. C'était des projets qui étaient prévus et qui ont été accélérés. Ainsi, nous avons créé une base de données numérique réunissant tous les résultats de tests et des vaccinations et qui comporte également le dossier médical de suivi à domicile, la mise en place d'un pass sanitaire qui est convertible en pass sanitaire européen, le développement et la généralisation de la téléconsultation à usage médical, mais aussi le développement de campagnes numériques d'information en utilisant tous les réseaux sociaux et tous les canaux possibles sur la COVID-19, mais aussi en faveur de la vaccination. Nous espérons que ces quelques enseignements pourront servir d'orientation sur la manière de mettre à jour ou d'adapter l'actuel plan d'action pour l'amélioration de la préparation et de l'action publique dans la région européenne de l'OMS 2018-2023 et nous souhaitons remercier le secrétariat pour l'ensemble des documents qui nous ont été proposés. Je vous remercie.
Thank you, Monaco. Next, the floor is for Russian Federation, followed by Denmark and Germany. Russian Federation, the floor is yours.
Спасибо, уважаемый госпожа председатель. Разрешите поблагодарить регионального директора Ханса Клюги, доктора Ницан и всю команду Европейского регионального бюро, включая страновые представительства ВОЗ, за приверженность, самоотверженное отношение и профессионализм в это трудное время. Самоотдача, с которой вы выполняете ваш долг, заслуживает восхищения. Спасибо вам большое. Какие основные уроки мы должны извлечь на данном этапе пандемии, которая еще не завершилась? Первое. В основе эффективного реагирования лежит управление, способность государства, руководства страны обеспечить координацию на всех уровнях, национальном, региональном, а также выстроить правильную коммуникацию с населением. Более того, крайне важна скорость принятия решений. Второе. Сильные системы санитарно-эпидемиологического надзора с хорошей лабораторной сетью и научной поддержкой являются основой для защиты от эпидемиологических угроз. Пандемия выявила серьезные недостатки систем реагирования многих стран. Наиболее пострадали страны, где отсутствует или децентрализованный эпиднадзор. Именно в системы эпиднадзора нужно инвестировать для повышения готовности на национальном, региональном и глобальном уровне. Отдельное внимание нужно уделять подготовке медицинских специалистов по вопросам инфекционной безопасности. Третье. Пандемия стала катализатором внедрения и практического применения новых технологий от генетических до цифровых. Необходимо внимательно изучить опыт использования технологических инноваций в борьбе с эпидемиями, оценить не только преимущества, но и риски. Четвертое. Решающее значение в реагировании на пандемию играет региональное и субрегиональное сотрудничество. Именно своевременные меры, принятые Россией совместно с партнерами на уровне СНГ и Евразийского экономического союза, позволили эффективно противостоять пандемии. Во всех перечисленных областях моя сторона готова поделиться опытом. Уважаемые коллеги, пандемия показала, что многое нам неизвестно, и во многом мы заблуждались. Например, оказались недостоверными оценки готовности стран, которые давались буквально накануне пандемии. В том числе среди наиболее пострадавших от пандемии государств оказались лидеры рейтинга глобального индекса безопасности здоровья, опубликованного в 2019 году университетом Джонса Хопкинса. Россия выступает за сильную, независимую и недублируемую ВОЗ. Планируя усиление международной системы предупреждения и реагирования, нельзя плодить сущности, создавать новое, не разобравшись, почему не работает имеющееся. Выступаем против форсирования вопроса о разработке нового соглашения о готовности к пандемии. Видим существенные риски политического, финансового и технического характера в этой инициативе. Мы еще не оценили извлеченные уроки, но уже говорим о создании нового международного договора. Нельзя, чтобы пандемия стала поводом для продвижения неподдерживаемых всеми странами-членами подходов, таких как внешняя оценка или обязательный допуск к местам вспышек. Выражаем готовность к дальнейшей совместной работе с Европейским бюро ВОЗ и всеми странами региона для защиты здоровья наших граждан от эпидемических угроз. Спасибо.
Thank you, Russian Federation. We have technical problems with the statement from Denmark here. So I would now like to ask Germany to take the floor, and after that, Azerbaijan and Austria. Germany, the floor is yours.
Vielen Dank, Frau Vorsitzende. Lieber Hans, Deutschland schließt sich dem Statement von Slowenien im Namen der EU und der Mitgliedstaaten an. Deutschland dankt dem Regionalbüro, das es auch für die Euro-Region diesen wichtigen Lessons-Learned-Prozess aufgegriffen hat. Auch wenn die Covid-19-Pandemie noch nicht vorbei ist, ist es wichtig, zurückzuschauen, um damit langfristige Verbesserungen bei der Krisenvorsorge und Reaktion zu erreichen. Es steckt sehr viel Wahrheit in dem Report. Er macht deutlich, was besser laufen muss, und es ist gut, dass wir den Action Plan to Improve Public Health Preparedness and Response in der WHO-Euro-Region überarbeiten. Hierzu ist es notwendig, die Analysen und Empfehlungen von Experten und Expertinnen aufzugreifen und im Sinne der Agenda 2030 und One Health umzusetzen, damit wir vor der nächsten Pandemie nicht überrascht werden und gut vorbereitet sind. Dies sind wir den nachfolgenden Generationen und uns selbst schuldig. Das Gleiche gilt für den Klimawandel, der eine existenzielle Krise für die gesamte Menschheit darstellt, den wir unbedingt aufhalten und umkehren müssen und auf dessen gesundheitliche Auswirkungen wir uns besser vorbereiten müssen. Aber wie verhindern wir, dass diese guten Ratschläge und der zukünftige neue Aktionsplan nicht wieder in der Schublade verschwinden? Wir benötigen eine stärkere Zusage von uns allen, uns den zukünftigen Review-Prozessen in der Zukunft auch ehrlich stellen und zusammen mit der WHO arbeiten zu wollen. Auch müssen wir die WHO durch nachhaltige Finanzierung dazu in die Lage versetzen, ihre Rolle besser wahrnehmen zu können. Das Regionalbüro in Kopenhagen sollte auch enger zusammenarbeiten mit dem gestärkten ECDC in Stockholm und anderen gut aufgestellten internationalen Behörden. Hierbei können digitale Technologien einen wichtigen Beitrag leisten, nicht nur bei der Krisenvorsorge und Reaktion, sondern auch zur Gewährleistung der Versorgung von Patientinnen und Patienten während dieser Pandemie. Auch die Stärkung der Widerstandsfähigkeit von Gesundheitssystemen gegenüber Pandemien erfordert einen Paradigmenwechsel in der Art und Weise, wie gesundheits- und gesundheitsbezogene Daten beschafft, verwaltet, zugänglich gemacht, zertifiziert, bewertet und gemeinsam genutzt werden. Auch hierbei sind der Schutz persönlicher Daten sowie die Datensicherheit wichtig. Weiter lassen Sie uns als Euroregion auch ein entscheidender Treiber für den globalen Lessons-Learned-Prozess sein. Dies schließt für mich ein, dass wir uns möglichst geschlossen bei der Sondersitzung der Weltgesundheitsversammlung Ende November für ein Mandat für einen IGV-komplementierenden erweiterten Pandemierahmen aussprechen, der auch neue rechtliche Schritte aufzeigt. Vielen Dank.
Thank you, Germany. Now I would like to ask Azerbaijan to deliver its statement, followed by Austria and then Finland. So, Azerbaijan, floor is yours.
Dear Chair, dear Director General, dear colleagues, ladies and gentlemen. Over the past 2 years, the COVID-19 pandemic continues to put much pressure on healthcare systems worldwide. This is an unprecedented crisis the world has been facing, with an emergency centered at the global public health. The pandemic has exposed weaknesses across the world's health systems, including the most economically developed countries. It has led to serious disruptions in the delivery of essential health services, including primary health care. To mitigate far-reaching implications on our economic, social, and political life, it requires an urgent joint response. In this regard, the transformation and enhancement of innovative digital healthcare platforms will make a positive impact on deployment of effective and proportionate public health, the scientific capacity of human capital, sharing international best practices, case management and contact tracing, telemedicine use in primary health care, providing electronic vaccination certificates, population awareness on anti-COVID measures, and psychosocial support for patients and frontline medical workers. We now have the opportunity to take advantage of these innovations for their successful implementation and effective solutions in the post-pandemic period. To tackle critical public health challenges in the long term, we need to go beyond health and address the socio-economic determinants of health. The time has come to embrace a new approach when investing in health and health systems should not be considered as expenditure, but as investment in the foundation of resilient and sustainable economy. With public health foremost in our minds, we need to set the status of health as a prior goal for social and economic policy. Azerbaijan forged ahead with the World Health Organization global vaccination targets. Within the framework of the strategy for vaccination of the population against COVID-19, adopted by the government in January of this year, about 40% of the population's target group is currently covered by the full course of vaccination. In addition, we also share vaccine reserves with other countries in the region. While remaining committed to the principles of global solidarity, I am convinced that our joint efforts to deepen integration processes in all areas will contribute to ensuring sustainable preparedness for future health emergencies and reach a new level of access to health services. Thank you for your attention.
Thank you, Azerbaijan. Now I would like to give the floor to Austria, and then after that we try to play the video from Denmark, their statement, and then I would like to ask Finland to be prepared. So, Austria, please.
Thank you, Madam Chair. Dear colleagues, Austria fully aligns itself with the statement delivered by Slovenia on behalf of the European Union and its member states. And the COVID pandemic has shown how much we can achieve when we really combine our strengths in research and development, in innovation, in the work of civil society and global solidarity. And for the sake of time, I don't want to repeat all the valuable statements already made, and therefore Austria supports all initiatives which foster collaborations and cooperation with existing networks, repositories, and scientific groups to strengthen knowledge and to contribute to the advancements of effective, efficient, fair, and equitable response to epidemic public health events. But may I draw your attention, because nobody has mentioned that,
And one of the lessons we also learned that we have to improve our governance structures on the global level within WHO itself. And I think we all probably can agree very quickly that, for example, the executive board of the WHO on the global level has not played a proper function and had not had the proper possibility to consult on many matters like how to set up COVAX, how we set up new pandemic preparedness hubs, or many, many other issues when it comes to trade or traffic. So having said this is, and we have to look forward, allow me to draw your attention that as a member of the executive board for the European region, I will put forward a small, but I think also an important proposal to strengthen the governance capacity of the executive board in the case of a pandemic crisis. And in line with the recommendations you find in several of the reports how to strengthen governance within WHO, and with the support of the Director General and many other members of the executive board of the member states, I will propose the creation of a standing committee of the executive board on pandemic preparedness and response, which, and this is the most important message, has to be convened within 24 hours after a global health emergency has been declared or announced. And this is to strengthen the role of the member states in guiding the Director General in a situation like this. And it is also to narrowing the gap between WHO scientific advice in the many bodies we have, and they are all working fine, and the actual policy level in the member states, and also to overcoming the structural shortcomings that have been manifested themselves during the current pandemic. So this is to safeguard that we, the member states, can start substantial policy consideration after such a pandemic health emergency situation has been declared. And this is maybe the very first lessons learned to improve our own governance structure within WHO, and it is also a low-hanging fruit. So may I ask all of you to support this initiative, which will be put forward at the next regular meeting of the Executive Board in January 2022. On the national level, if I may also echo what some of the other delegates already have mentioned, on the national level, I think one of the most important lessons we have learned in Austria is how important it is to strengthen primary health care. You know, as a high-income country, we didn't have the big issues when it comes to ICUs, emergency capacity units, et cetera, ventilators or whatever. But, you know, it manifested that we do have a problem at the level of primary health care. And this is not only a structural problem, it is, as it already was mentioned too, that we do need a suited workforce in such a kind of situation, in a pandemic situation. Otherwise, and if we don't invest in this suited workforce, we cannot succeed in a better pandemic preparedness and response. Austria, therefore, will invest in this sector quite a bit of money, and we will use a substantial part of the EU recovery and resilience funding for these purposes, which we can spend on the national level, because this is probably on the national level the most important lessons we have learned, at least here in Austria. Thank you very much, and I yield back to you, Madam Chair.
Thank you, Austria. And now we are going to have the comment from Denmark, and after that Finland, and then we will have a break because we have to then start at 16 o'clock the report from the Pan-European Commission. But now Denmark.
Dear ministers, dear colleagues, thank you for sharing your experiences on best practice To become resilient against future health emergencies, it is essential that we learn from each other. Unfortunately, the challenges are far from over as new variants of COVID-19 keep emerging. At the same time, access to vaccines remains a challenge in many parts of the world. Throughout the pandemic, communication has been the center of our effort to manage COVID-19 here in Denmark. It has been a priority to maintain trust in health authorities. Continuous updates and transparency in the decision-making have been key elements in tackling disinformation, especially regarding the vaccines. In areas with high incidence rates, we have engaged with local communities in order to break through potential cultural or social barriers and encourage social distancing, persistent testing, and vaccination. Two measures in particular have been valuable weapons in the battle against COVID-19: easy access to testing and the systematic rollout of vaccines. Testing facilities located in all areas of the country where citizens could drop in without appointment and free of charge have led to an increased number of tests, and this have enabled comprehensive contact tracing. And up until September, the digital Corona passport has been required to enter most public places, which has played a vital role in the gradual reopening of the Danish society. In the Danish vaccination rollout, frontline health workers and vulnerable groups have been first priority. During the last stages of our rollout, the oldest and the youngest in a target group have been vaccinated simultaneously. And by sandwiching those most at risk with those more likely to be barriers of the virus, we reduced the risk of spreading of the virus. Continuous sharing of experience is vital in order to bounce back from the challenges we face both at a national, regional, and global level. Thank you.
Thank you, Denmark. It seems impossible to close the agenda item in time, and I propose to suspend the session after Finland's statement and reopen then again perhaps early in the morning tomorrow, but we'll come back to that then later. But now I will give the floor to Finland and then some household information. Finland, the floor is yours.
Thank you. Honorable Executive President, Regional Director, Excellencies, delegates. Finland aligns herself with the statement of the European Union and its member states and the statement of the Nordic and Baltic countries. The results of Finland's response to the pandemic have been relatively good, with the lowest attack rate and population mortality of the region and the third lowest case fatality rate. Our society has resisted the economic shock relatively well. Our health system has also demonstrated resilience despite the substantial strain on health services provision at all levels during the pandemic. The comprehensive government security strategy for society, effective governance, and a tradition of collaboration across sectors, coupled with trust in public health institutions and their messaging, material stockpiles, and very importantly, the universal social protection net, have all contributed to these results. The normative guidance of WHO and the EU cooperation have very significantly supported our response. We took rapid action, even without full certainty of the effectiveness and consequences of those actions. Legislation triggers were adjusted to justify the necessary public health actions, always acting strictly in accordance with principle of rule of law. The trust of the population in health experts and government decision-making has to a large extent remained high. Nevertheless, none of the plans and preconceptions were comprehensive enough and did not contain truly realistic scenarios for a pandemic of this scale and magnitude. We were truly shocked how during the first weeks of the pandemic, international cooperation according to the IHR was set apart, and how country after country turned inwards and started to look for commodities. To avoid a similar catastrophic situation in the future, we need a revision of the international preparedness regime to increase country-level preparedness, including through the full implementation of the IHR, and to invest in primary and public health capacity, workforce, and digital solutions. We also really need novel ideas of how to ensure a sufficient surge capacity in our health system, not to speak about fast development of and equitable access to various countermeasures. Finland will participate constructively in our common projects to make the world a safer place from health emergencies. Thank you very much, Madam Chair.
Thank you, Finland. We have had very intensive day today, and it's time for a pause. I now hand the floor to Executive Director Mr. Butler for some housekeeping message. Please.
Thank you very much, Madam Chair. So we're going to carry on with item number 3 tomorrow morning at 8 a.m. CET. We are going to open proceedings at 8 a.m. CET because we simply have not been able to get through item 3, and we have a long list of speakers still to come, and of course a response from our regional director. So as we are set for a well-deserved healthy break, we are going to invite you to come back at 4:10. That's in about 15 minutes. But before you leave us, I'd like to invite you for a short relaxation session with breathologist Stig Severinsen, who is a world-famous freediver, who will introduce us into some simple breathing techniques for relaxing and re-energizing. Stig, a warm welcome. Over to you.
Thank you very much, sir. I hope that I'm on camera, will be invited on camera. So I just need a little confirmation that I will be on so everyone can see me. And I think it's coming
You're
up.
there. Great, we have you.
Welcome, everyone. Thank you for this wonderful opportunity to share some breathing and some insights into the wonderful things we can do with simple things as breathing. Let's get right into it, dive into the first exercise. It's just natural breathing. So all of you sitting there, wherever you are, start breathing with your nose. The nose is for breathing, the mouth is for eating. Why is this important? Because the nose is a natural filter. It gives the air the right temperature, the right speed, the right moisture. But when you breathe with your nose, you also have large amounts of nitrogen oxide, NO, entering the lungs. Nitrogen oxide is antibacterial, antifungal, and antiviral, something we can all use to improve our daily health. So breathe with me into your belly. And just breathe out through the mouth. That's fine. Again, feel the breathing, feel the air coming into your nose. Very importantly, there are 4 phases in breathing. 4 phases. You breathe in with me all together. Then you have a slight pause. Then naturally just relax and exhale, and then again have a slight pause. Time for the breath to turn. So 4 phases. Stress breathing has 2 phases. We all know that, right? And if you do it completely wrong, as many people do, especially those who are mouth breathers, you breathe with your mouth. You go into your higher chest, you stress your body, you produce adrenaline and cortisol, and it's not good for your everyday work, and not at all if you're sick or ill by any means. So breathe with me, put a smile on your lips. Through the nose, as simple as it is wonderful. You will feel the lung expand and the energy and the oxygen coming into your system at an optimal rate and level. Okay, one last time with me. This will lower your heart rate in a single breath. It will lower your blood pressure and bring you into a calm and relaxed state where you are more in control of your mind as well. Let's go to the second exercise. You've been on for many hours. You're in all parts of the world, which is wonderful, this global gathering, but we can't have you all fall asleep. You need to be sharp. You need to help all your fellow global citizens. So let's do a breathing where you wake up a little bit. I know how it is to be long days at the office. So let's energize the body a little bit. How do we do that? Again, with breathing. We shift the rhythm, we change the dynamics of breath, and it will change your state of mind and your physical state as well. So breathe in with the nose again. And a shorter pause, and then exhale with a little puff, like good work there. I see a lot of you really engaging. I thank you for that. Now, this is a slight hyperventilation, but the body can absolutely tolerate this. This is a great workout for your cardiovascular system, your cardiopulmonary system. So your heart, your lungs, and all the blood vessels in your brain and your body are getting a little bit more blood now. You're raising the blood pressure, you're raising the heart rate, but you're not moving from your chair, yet you're exercising physically. A very good thing also, if you're in a hospital, imagine all the people we could help by actively using the breathing, even from a supine or from a neutral position. Let's do it a little bit more. 3 times like this, you'll be waking up like a cup of coffee. And last time. Okay, you're firing up the sympathetic part of your nervous system. We have a choice with our breathing to go into the relaxed state or the more active state. Now we went into the active state. Now for the last exercise, I want you all to come back to a composed, relaxed, and intelligent place where you're not fearing anything, you're not feeling your body in a rush. This is 1-2 breathing. I call it relax on demand. I teach this to Navy SEALs and to Royal Air Force pilots and to Olympian athletes, but also to people in rehabilitation. That is the best exercise to relax quickly, thus the name relax on demand. It's called 1-2 breathing. So the inhale is through the nose. 1, come with me everyone, breathe in, smile on your lips, slight pause, and then exhale, double the time. I really see a lot of you engaging. I'm really, really honored to have you at this time of day engaging. Again, come with me, breathe in, slight pause, and then use your lips or mouth to make a purge. When you're using your mouth or tongue to make a valve, you get airflow control. It means you decide how long the exhale is going to be. So in this case, inhale is about 4 seconds. Come together with me. Slight pause and breathe out 8 seconds. A little bit more. You're activating the parasympathetic part of your nervous system. It is the rest and digest. It leaves time for recovery, for mental composure, and for smart decisions, which I know you all will have to take over these long days. So these were 3 little simple exercises that can be expanded much more. But it gives you a tool where you come in direct contact with your body and your mind. And with breathing rhythms, you can change how you feel and, more importantly, how everyone is feeling. I can see we have 30 seconds. So let's do a united breathing with the 1-2 breathing. So we all breathe together, because whether you believe it or not, actually, when you're breathing and people are observing you, it has an effect on them. They're mirroring your breathing. If you see people that are stressed, you will start breathing here. If you see relaxed breathing, if you look at a kitten or a baby, you will start to relax and breathe in a more efficient way. So let's do it together. You have not seen each other for 1, maybe 2 years. At least let's share the breathing and feel the rippling effect around the world in the 1-2 breathing. Everyone, just 3 breaths together. Breathe in. Slight pause and exhale and smile. Let your shoulders go. I even invite you to close your eyes. Second breath, breathe in slowly with your full might and life. Slight pause and a smile. Let go of any wrinkles. Everything that needs to go, let it out. Slight pause and a last time. Everyone breathing the same air, the same oxygen from the ocean. Everyone is breathing in and letting go, breathing out. Everything you don't need out from your life, breathe it out. And feel ready to go with the next session. Thank you for joining. Thank you for the incredible honor of having me on. And I hope to meet you again. And I wish you happy breathing.